Let's talk about ankle sprains. Ideally, specifically, the muscle called the peroneus or fibularis tertius muscle, in which helps control with certain movements of your ankle, such as dorsiflexion, bring that toe up, and eventually, yep, there he is, and eventually going into what we call ankle eversion, moving the ankle or foot sideways, outside, or laterally. There you go. So let's talk about how we treat it. All right, so I'm going to demonstrate one of the things that we do when we work with some ankle sprains. A common area, a common muscle that tends to be fibrotic or from an injury from an ankle sprain, such as mine recently, is the peroneus or fibularis tertius muscle, which is coming across through that bony part of your ankle and down into here. And that tends to be an area where if you newly sprain it, it tends to be very sensitive. So those are the things that we have to be working with. So yeah, you could do a little bit of some Graston or factor-ish work. What I've noticed that worked very well is active release technique or ART on it. And that muscle is actually very small, right in here. You feel that here? Mm-hmm. Okay. And it's really literally the same exact, because what happens is when we tend to sprain our ankle, it's an inversion sprain. That's usually the case of the injury here. So dorsiflexion this way tends to be a very painful thing, which was happening to me the other day after I kicked somebody, from sparring, not from anything else. So what we normally do is I get right onto the muscle here. We go into dorsiflexion eversion. So this is again mainly more for the clinician, and we do apply active release technique. You could guide them into plantar flexion inversion or down and in. So have the patient go, I usually have the patient go up and out, and now go down and in, just like this. All right, just be careful with this because this could be sensitive in the very beginning. Up and out, and down and in. Now this is something that I actually personally worked on myself when I sprained my ankle. Now, again, this doesn't work for every single sprained ankle because the extent of the injury could be greater. If it's a greater sprain, a big pop and a huge swelling, this could help alleviate it, but it's not going to fix it. If it's a very mild one, like a grade 1, minimal to no swelling, this is definitely an effective way of treating it too. So go ahead, up and out and down and in. All right, up and out and down and in. How's that feel? And this is where you had sprained also, right? Yeah. Oh, okay, all right. So up and out and down and in. All right, for clinicians here, again, it's really running from that superior portion of the lateral malleolus, and it travels down into the metatarsals here too. It's a small muscle. It's a peroneus tertius or fibularis tertius. Okay, cool. And then we proceed to rehabbing the ankle, which we'll talk about at some other point. Thanks.